My name is Brian Aragon, and this is my informative speech on the electrical cardiogram. An EKG is a test that checks for problems with the heart's electrical activity. The EKG translates the heart's electrical activity into line tracings on paper and is one of the primary tools in detecting a heart attack. A heart attack, also known as a myocardial infarction, is a health condition where the heart's normal blood supply is disrupted, which in turn causes the cells in this part of the heart to die. Approximately 6 million people in the United States get hospitalized with chest pain. About 1.5 million Americans suffer a heart attack every year, where as many as 500,000 die. When someone suffers or complains of chest pain, it is important to find the unexplained cause of the chest pain, which could be caused by a heart attack. Having an EKG thoroughly examined by a physician can reveal whether you are currently having a heart attack or have had one in the past. I am a certified paramedic in the state of Florida and work at Baptist Hospital in Miami in the emergency department. The majority of patients we see on a daily basis complain of chest pain, and the first and most important exam we run is an electrical cardiogram of the heart. The EKG must be read by a physician within the first 6 minutes of arrival because, as it is known in the medical field, time is tissue. The EKG machine consists of electrodes, which are tiny tabs that stick to the patient's skin and pick up the electrical conductivity of the heart. It is very important that each electrode, also known as a lead, is properly placed on the body for correct interpretation. The 12-lead EKG, which consists of 12 different views of the heart, requires 10 electrodes placed on the body. The first 4 are known as the limb leads, which are placed on the shoulders and the lower extremities. This placement analyzes the inferior portion of the heart. The remaining 6 are known as the V leads and are numbered V1 through V6. The V leads are placed on the chest and along the rib cage. V1 and V2 analyze the septal, or the middle portion of the heart. V1 is to be placed at the 4th intercostal rib, just to the right of the sternum. V2 is placed at the exact same location, just to the left of the sternum. The landmark for V4 is at the 5th intercostal space along the mid-clavicular line. Find the middle of the clavicle, trace it down, and you should be just under the nipple. V3 simply goes between V2 and V4. Leads V3 and V4 analyze the interior, or the front portion of the heart. V5 is placed level with V4 and just left of the axillary line, or the armpit. V6 follows V5 and is placed just along the axillary line. V5 and V6 analyze the lateral portion of the heart. Although I am a paramedic, it is not my job to interpret the rhythm strip. It is my job to find the nearest physician for correct interpretation. To an untrained eye, an EKG may look like a bunch of waves on paper, but to a doctor, it could be the difference between life and death. The different waves shown on EKG are classified in a specific order, and they are as follows: the P wave, the QRS complex, and the T wave. The P wave shows the electrical conduction system as it passes from the superior atrial chambers of the heart down through the inferior ventricle chambers of the heart. Now, as the ventricles contract, also known as depolarization, the QRS complex is registered. Since the ventricles have more mass and is the muscular portion of the heart, the QRS complex may have a higher amplitude than the P wave. The last wave is the T wave, which indicates repolarization of the heart, which is also known as when the heart relaxes and prepares for another cycle. When early repolarization of the ventricles occurs, the ST segment may be elevated. This in turn is a clear sign that death has occurred to the tissue, resulting in a heart attack. It is now up to the physician to declare whether a heart attack is taking place and what interventions need to be made. As you can see, the EKG is a very important and useful tool in detecting a heart attack. Many people suffer from chest pain on a daily basis and don't act upon it right away. If indeed you are having chest pain, upper abdominal pain, pain in the left arm, or pain to your jaw, seek medical attention. Call 911 or visit your nearest emergency department. I know it's a bit of a cliche, but it's better to be safe than sorry. Time is tissue, and if you act accordingly, you could be saving your own life or that of a loved one.